Okay, so now we're looking at video 2, which is the introduction to the DSM-5. So now that we know the criteria for looking at one when one may have a possible disorder and talking about the history, let's talk about how they classify different disorders. And once they classify, let's talk about the impact of labeling on psychological disorders. So, the American Psychiatric Association rendered a diagnostic and statistical manual of mental disorders, otherwise known as the DSM, to describe different psychological disorders. The DSM 5 offers practitioners a common and concise language to help diagnose individuals. Here's two big key bullets here. It's not used to treat individuals, and it's not used to give advice on treatment. It is a list of the different disorders and specific symptoms that the patients may have with the different disorders. The DSM-5 was released in May 2013, and nearly 300 psychological disorders are compared to the 60 in the 1950s. So there are over 300 psychological disorders one may have. So again, we're not going to talk about all 300 different disorders, but we will talk about the major categories. The original DSM was introduced in 1952. It moved from a very subjective idea in describing people to a very operational definition with diagnosing an individual with specific elements for each disorder instead of just giving a broad statement. It is specific criteria and is more reliable. The diagnostic is based on signs and symptoms individuals displayed. Signs are very objective observations of patients, either physical or mental disorder by diagnosis. It also could be diagnosed by a clinical psychologist. And symptoms are patients' subjective descriptions of physical or mental disorder. So here is a category of the different disorders that we will look at. Again, we won't look at all of them, but it might be good to copy and paste this chart and keep it in your book. The book starts looking at different neurological, neurodevelopmental disorders at early age, and then schizophrenic disorder, bipolar related disorders, depressive disorder, which talks about mood and bipolar, anxiety disorder, whether it's panic or OCD. OCD has its own category now, which is new, which is of the obsessive compulsive related disorders. Then talks about trauma, traumatic disorders. It talks about dissociative disorders, or what people often known as multiple personality disorders, somatic symptom and related disorders. We'll talk about feeding and eating disorders, which we've talked a little bit about in class already. The elimination disorders. 12 we've looked at, it talks about sleep and wake disorders. 13 is sexual dysfunction disorders, and 14 is gender dysphoria disorder. 15 is disruptive and impulse control and conduct disorder. 16 talks about addictive and substance-related disorders. 17 is neurocognitive disorders, and this more looks at memory disorders. Then 18 will talk about personality disorders in class, and 19 paraphilic disorders. 20 kind of categorizes other mental disorders that they're looking at now with technology, the impact of technology on different disorders. And then 21 are ones that are in further study. So these are, again, the 21 different classifications. We will look specifically at 6 different classifications. And within those classifications, it breaks down to many different disorders. So this chart talks about the rates of psychological disorders in society. So half of all Americans at one point in time will meet a criteria of displaying one type of potential disorder. But the number one, if you look at this chart, you could see that any mental disorder that the population is faced with is 26% of the population is faced with any of these disorders on a daily basis. The top one that's in this chart you can see is anxiety disorder is a big one. It's 18% of the population. You could also see any mood disorder makes up about 10% of the population. And again, every single disorder is not mentioned in the chart. These are the more dominant disorders that they see. Autism and Asperger's and ADHD are not included. They looked at 14 different countries in the United States, and they looked at the different areas and the rates of the disorders around the world. And the United States, you could see, is any mental disorder. We are having the highest rate of mental illnesses. Ukraine is right below us, France, Colombia, Lebanon, and so forth. Kind of talks about the rates of the different disorders. Criterion diagnostic material. Clinicians are more confident in labeling somebody with a disorder when they have two or more indicators and symptoms within that disorder. The more the extreme and the more dominant the symptoms are, the greater the confidence that they feel on diagnosing and labeling an individual. And it could take a process of 6 months in order to diagnose and a patient with a specific disorder. There are some dilemmas with diagnosing an individual with a specific disorder, whether it's OCD or bipolar depression. Critics of the DSM argue that labels can stigmatize individuals, and we'll talk a little bit about what it's like to be stigmatized in class. People are often labeled as different, and this can impact their attitude and their thought process that they are not good enough potentially. Also, it could lead to stereotyping individuals, and sometimes now that we have a label, we could now overdiagnose individuals because we have a label. Benefits, however, with diagnosing labels can help healthcare professionals communicating with one another and establishing a therapy and a treatment program for the individual. It gives people answers for their behaviors. It allows people to look at similar cases and treatments that have been done, and allows doctors the knowledge of what might occur with the patient. So lastly, your book talks about other statistics that I think are interesting. In the America, mental illness is far more common than people actually realize. Over 15% of the population suffers from a diagnosable mental health. That would mean that if I had 100 students in my class, 15 of them may be diagnosed with a mental illness. 56 million Americans meet the criteria for a diagnosable psychological disorder. And over the lifespan here, this quote says that 32% of Americans suffer from some sort of psychological disorder.